And this is a really interesting story. I hope you enjoy it. Ramon Soto.
Thanks, Steve. Thank you. Good morning, everybody. Just so I can calibrate my conversation with you all, who has heard of Northwell Health? Who's familiar with the brand? Okay, so this will be easy then. So then just a little bit of a tee up in terms of who we are and what we do. Northwell is, as Steve mentioned, a large health system. We're in the metro New York market. We're the largest employer in the state. We have about 85,000 employees, 21 hospitals, about 1,000 ports of entry for consumers to consume health. We also compete in a hyper-competitive market. New Yorkers have great choices in terms of the care that they receive, who they can partner with for their health care. So when we did our rebrand about 7 years ago, we were faced with this question: how do you really differentiate? We compete with brands. New York Presbyterian literally got their charter in 1751, signed by King George. Storied legacy academic medical centers. We're 30 years old, and our brand is 7 years old. So how do we tell a different story? How do we tell a compelling story? How do we tell a relevant story? And how do we redefine how we take the journey with consumers? That was the task at hand. And as Steve articulated, we really dug into being a purpose-driven brand. Now you're going to ask yourself, we're in the provider space. Aren't all providers purpose-driven? And the answer is no. We're all certainly mission-driven. We're here to provide care. But the fight for the transaction, the fight for the health event, the fight for profit, it's alive and well, and it is where everybody else is clustered. So how do we occupy a purpose-driven mind share that allows you to take the journey with us, allows us to take the journey with you, redefines the relationship, has you think of Northwell in a way well before the health event so that you are predisposed to use our services when you actually do have a health event. And what we're going to use today is a use case. We're going to talk about gun violence. And as Steve articulated, one of the cornerstones of how we drive this purpose-driven branding is we try to tease out these hidden injustices in society. It is a travesty that where you live can dictate how long you live. And what does Northwell do? What does healthcare do to change that paradigm? It's a tragedy that there are food deserts in New York. It's crazy. There's like 1.4 million people who don't have access to fresh, nourishing food. What is healthcare doing to change that paradigm? And the latest tragedy that I want to share with you is around gun violence. And something happened in 2019 that is absurd. In 2019, guns became the leading cause of death for children in the United States. Not very well known. Can I ask, who knew this before coming into this room? Okay, probably about a third of you. It is, as a nation, a disgusting place to be. If we were having this conversation in any other Western industrialized nation, they would probably say that automobile accidents were the leading cause of death, because it's truly an accident. But we crossed this Rubicon in 2019. This is an illustration of a study done by the CDC, published in the New England Journal of Medicine, and we only found out about this in May 2020. So what do we do as a society to bend this curve? I remember reading the study, and I was honestly incredulous. I thought, we're better than this. We have to push this in a different way. When you tie this with the data, by the way, we've had over a 300% increase in children presenting with gun wounds into our children's hospital in New York. It's a disgusting place to be. We're literally pulling bullets out of babies. So Northwell organized to try to attack this issue. Now, it is a perilous journey because it's full of emotion, it's full of politics, it is divisive, in this place where there seems to be two sides that can't agree to anything, how do we start attacking this challenge? And the reality for us is we had to reframe the debate. And this is where we went back and we used the gun violence slide, that tragedy, that absurdity, to our advantage. And we started digging into the data. And the data actually illuminated a path forward for us. I do apologize because these graphs should be a little bit bigger in terms of what the data suggests, but let me share with you what the data is saying. That once you present this to parents, 60% of them didn't know that this was an issue. 60% of them did not know that guns are now the leading cause of death for children. 60% of them did not know that this is a safety issue for their children. Now, think about that. If you have children in particular, there's like this cultural truth, this energy to tap into. As a parent, we will do anything to protect our children. But we have to know. So there's this wonderful opportunity to make parents aware. And then in addition, we have about 90% of them would want to know if they were visiting another household, is there an unlocked gun in the house? And it makes sense, doesn't it? We want to protect our kids. And in addition, these parents said that if somebody asked them, 97% of them would say they had no problem having the conversation that there's an unlocked gun in the house. So you see a lane here. You see a let's build awareness and let's spur the conversation. That became the energy for us reframing this debate away from the Second Amendment. And by the way, the Second Amendment, it's not going anywhere. There are over 400 million guns in the United States. There's 320 million people. It's codified in the Constitution. How does healthcare occupy its lane, its own lane, and reframe this as a public health issue? We have brand permission to do it. As you saw, consumers want to understand it. They want to protect their kids. It actually turns into a rich vein to mine. So for us, how do we break this taboo and we spur a conversation, a social conversation on what is going on underneath the surface, this hidden injustice? So our movement we called Doesn't Kill to Ask. I'm going to run a little bit of a sizzle reel so that you can get a sense of what the creative looked like.
We just wanted to ask, and it's totally cool. There's no issue. The tiger.
And we were just wondering if he'll be locked up.
Yeah, will the tiger be locked up for the whole time?
Absolutely. We never let him out with kids around, not even our own.
It doesn't kill to ask about unlocked guns in the house.
Northwell Health, New York State's largest health system, is encouraging parents to ask others about the status of guns in their homes.
A provocative PSA puts parents on the spot and urges conversations about unsecured guns in the home.
The issue of guns is controversial, but the damage to kids and families and doing something to prevent it should never be controversial.
So special thanks to our partner Strawberry Frog in helping us articulate the story. A couple things about the creative. The support work is all done in PSA fashion. I'll get to why we did that. The actual ad, you saw we used levity to get into an incredibly serious conversation, and that was very purposeful. We did a tremendous amount of research into this. The frogs helped us develop 7 different concepts, and it's because this can be so perilous in terms of the slippery slope. What's the unintended meaning within the ad? How are you addressing this to the population, to the public? We really wanted to stay away from any potential political connotation and make this firmly a healthcare issue, A. And then B, we also studied all the work that was out there already, and they were very dramatic images of the aftermath of a gun violence incident. Literally, images of carnage, bullets being pulled out of babies. And unfortunately, none of that work worked. The trend has not been bent. Nobody's really occupied the healthcare aspect of that. So we wanted to use a different way, and we used that absurdity of that first chart that you saw as energy to build the levity behind it, to make it accessible, and to make it something that parents would talk about, take away, recall, and then have a conversation about. In addition to all the wonderful creative work that we've done, you saw at the end of that clip a little bit about partnering with other health systems. So probably about a year ago, I was in at a conference hosted by the AMA, very similar to this, with 67 CMOs from other health systems. And I was sharing with them our intention to do this campaign. And it was fascinating. They were all really galvanized about wanting to participate. That led to a series of conversations, and then ultimately we were able to secure partnership with 157 health systems across the US to take our creative, which we offered gratis, rebrand it themselves or brand it generically as a PSA in their markets and have them run in their markets. So it is a way that we can use the power of our industry to help this message get into other markets. And it was very powerfully received. It's ran pretty heavily in Chicago, it's ran pretty heavily in Philadelphia, and it's in various states of rolling out across the country. We built digital assets because it's not enough just to alarm parents that, hey, there might be an unlocked gun in the house. How do you actually ask the question? How do you have the conversation? So we developed fulfillment material to do this. And you're going to ask, okay, that's great. What did this actually do? So let's just go through the numbers a little bit. And to me, this is the money slide. We did a tracking study, and we talked to consumers. We held out a control group who were not exposed to the advertising. We benchmarked that against consumers who were exposed to the advertising. We saw a 250% increase in their ability to have the conversation about an unlocked gun in the house. And these are the first green shoots of social change to address this issue. And they clearly got the message. They saw the advertising, they saw the material, they know to ask, they know to act. This is a little bit of an eye burner, I do apologize. There's like one block here. So when we did our research, we had to make sure that both pre and post, we were looking at different subsegments and how were they responding to the issue and how are they responding to the creative. So we talked to Democrats, we talked to Republicans, we talked to independents, we talked to parents, we talked to gun violence survivors, we talked to police. We benchmarked those norms in the New York market versus the nation, and that was really done to help our partners outside the New York State. And this was campaign performance. Afterwards, look in the green box under parents. This does ad recall, likability, and then likelihood to ask. And look at parents, 74% likelihood to ask. It's a super powerful number. It's the core target market that we're going after. Clearly, we're incentivizing them to have the conversation. And these are just different versions of the creative that were illustrated in the marketplace. So we know we're on the cusp of doing social good, but are we creating brand love? Are we getting people to think of us a little bit differently? We do a tracking study in our brand monthly. You all probably have similar charts to this. We measure a number of key brand attributes. You can see the dark blue is Q3 2022. That is our trend line. And then the campaign started in October and November of last year. And this is 2 months worth of data. You see the extreme spike in the dotted black line. So we're clearly creating brand love here. So we're excited about the campaign. We're excited about the derivative effect for our organization and how we differentiate ourselves in the New York market. And most importantly, we're excited about the benefit to consumers in the New York market. And then in terms of brand love, there's really just a few things to point out here. When you're exposed to the campaign, we actually have a lift in consideration to use our services. And that was not a KPI. There's really nothing to purchase as a result of this ad. But we have more consumers who are considering us for purchase, which is great. And the likelihood to recommend jumped by 26% as well. And we're known for gun violence now in the New York market, so we're very proud of these. 2 more slides, and then I'm going to open it up for a Q&A. It's not enough to just put stimulus out there and spur a conversation. How do you mobilize the rest of healthcare? And our CEO has developed a CEO council. There are 50 health systems that are now bonding with Northwell to attack this on a clinical basis. Is there the right research that's in the marketplace to get behind gun violence and bend the curve? Do we have the right clinical protocols in our institutions to screen for gun violence or the potential for gun violence? Can we interject clinical protocols to get ahead of the curve here? So we're really excited about this. And then lastly, if you guys want to get involved, every year Northwell does a gun violence prevention forum. It's a convening of the who's who in this movement. This year it'll be headlined by the US Surgeon General, a number of speakers. It's about 100 people in the room, but it's also streaming. So if you want to go to preventgunviolence.com, free to participate, maybe look at a little bit of content and educate yourselves. So with that, I'm going to stop and open it up to any questions that you guys have.
Ramon, thank you so much.
Pleasure.
Questions?
Hi, Matt Dusick from Providence. This is actually not so much a question as just a comment that, Providence is very proud that our name is up there on the CEO Council, and just a heartfelt thanks for taking a leadership role on this important issue.
Well,
we really appreciate it.
Thank you for the partnership as well. Thank you. Really appreciate that comment.
Hi, Jeff Alderman from Ad Media. So a couple of years ago, launched a Make Safe Happen campaign with Nationwide Insurance during the Super Bowl, largest event, obviously. And great cause, right? I think, again, at the end of the day, it's like, how do you grow beyond even kind of your influence area? So if it's beyond hospitals, right? In Michigan last week at Michigan State, you guys probably heard the national news, right, about a shooting on campus, right? So again, how do you grow this? It's a wonderful cause. It's a big problem, right? So have you thought about kind of growing beyond hospitals to other partner, I guess, groups like insurance companies, universities, et cetera?
Yeah. It's a great question, and I'd say we take multiple paths on force multiplying this work. The first is to create the right network that's talking about it as an issue. So Northwell, 5 years ago, launched the Gun Violence Prevention Center. It's run by a clinician, and there are a coalition of both for-profit and not-for-profit actors that we work with to talk about how we move the needle. This is about, unfortunately, accidental death. But the reality is the majority of death related to gun violence is suicide. So there's a very rich lane to be mined there with, I think, a different work stream. And then you can break down deaths related to guns into 2 categories: accidental discharge and purposeful discharge. How do you deal with both? How do you deal with the violence aspect of this, which is a different type of problem? So it's a different coalition that we're working with there. I'd say all those efforts are green shoots. We're probably spending the next year to really fortify what we're seeing as a nascent effort. We've committed to a wave 2 of this. We've convened the 157 health systems that we talked about, what that next wave will look like. We're inviting them to get more active and involved. So this isn't just Northwell handing off material, but they have a vested interest in understanding it and driving it from their community. But I think your point's a really important one. This isn't solved by one thing or one act. This is going to be 100 different little acts and big acts that bend this curve. So I think we have to form coalitions in very different ways to move this in a positive direction. It's a great question. Thank you.
Ramon, you mentioned that not taking the explicit route of using shocking images was the route you didn't take. But as you also mentioned, there are a lot of possible potential missteps here, and you guys went through a bunch of alternatives that you played with. What are some of the missteps you think you avoided here? What are some of the other ways that could have misfired or you thought would have misfired in an attempt like this?
Yeah. It's really interesting because the research, both the research trying to understand the category and prepare to enter into it, and then the research on the concepts were very illuminating. And what we found is there's this counter-cultural stream that's going on in society, the divisive nature of debate. And some of the early work that we had tested, it didn't matter what we said, it was interpreted as an attack on gun rights. And that was the slippery of the slopes for us, because if you push off 50% of the population, even if it's an extreme view, or that comment starts being debated in an echo chamber, and it takes away from the work, we knew that was a landmine for us. And it really fortified the levity approach into the conversation. There's nothing about gun rights or gun ownership. This is clearly about safety. And we knew that there was a very safe lane for us. I will tell you, you still get your fair share of people commenting. I review all the emails that come in. We monitor social media for the impact. Forgive me, but I would characterize the majority of those emails as crazies coming in. There were a few who I engage with, and I regret engaging with them. Because, by the way, I'm a gun owner, and I believe in gun safety, and I'm an extremist at it, and I'm a dad. So that's the position I took with these people. I felt I had the background and the ability to debate. There was no debating. In their eyes, this was the jackbooted thugs were coming next to break down their door and take away their arms, and this was a Trojan horse to get into it. Luckily, that was a really small part of what we were hearing, but it's still real and it's out there.
But what was the brand policy for answering social comments?
So we have a standard holding statement that we offer up, and then we, interestingly enough, we drive people back to the data. The crazies, by the way, don't like CDC data, so it's kind of funny to push them back to that.
There's another rabbit hole for you.
Absolutely.
We have another one back here.
Yeah.
So I have a little bit of inside information, but I wanted to ask you a question, which is, so gun violence, so you're purpose-driven, and you activated that with this movement thinking. This is obviously one pillar of a number of different initiatives you've done over the years. Recently came out that Northwell has half the turnover rate of nurses of any other hospital nationwide. So you're retaining talent, you're engaging consumers in new ways. Can you talk about some of the ways that you have done similar type of programs in innovative ways?
Sure. So there's a couple of things there. One, Scott mentioned nurses. So there is a fight for talent in healthcare. You guys all know this. The turnover rate on the nursing front, it runs between 18 and 25% in any particular market. It's actually a ridiculous number. Northwell's rate is half that. We're about 9% turnover. And we're very proud of it. And it's because, as a purpose-driven brand, this isn't just for consumers, it's for employees as well. And there's a tremendous amount of pride and belief in what we do, and how we create value, and how we wear our mission on our sleeves, and believe what we say and do things differently. And that has created secondary benefits to the organization. Scott's absolutely right in terms of how do we do this in other ways. So when I started on the branding front, our strategy was to build a destination healthcare brand. And you're going to ask, what is that? And it really is a brand that has a relationship with consumers before the health event. So that you are known to us. You get to see the richness of this organization and engage with it in a different way. And engagement is the key word. So I can't buy enough 30-second media to outshout my competitors. It's a hyper-competitive market. Spending in media for healthcare, my competitors, it's going up 22% per year. And it is an unsustainable rate. So how do I go in and how do I engage differently with consumers? And what Scott was referencing is we experiment a tremendous amount to have a conversation with consumers very differently. One experiment we did back in 2019 was with Netflix, and we partnered with Netflix to do a 9-episode docudrama called Lenox Hill. It was a top 10 TV show for 4 weeks on Netflix, and it created not just a lot of local brand love, but national brand love and international brand love. So on the Netflix platform, there's about 230 million users, about 50% of them are in the United States. And the dividends were pretty profound. Now, if you go in and you do this as a branded content play, you're gonna write a check for millions of bucks. We did not. So we had negotiated a different route to execute this. That has led to 7 projects, all in the streaming video space. We did a documentary on COVID. We invited a film crew in to really document the truth. It's probably more an important artifact of history on what really happened in New York, when New York was the epicenter of COVID in the United States. It's called The First Wave. We partnered with Hulu and National Geographic to develop that. On March 29th, we will air our second Netflix docudrama called Emergency NYC. It's more about the higher velocity aspects of healthcare in the New York market. It's 8 episodes. It's better than the Lenox Hill show. We expect that to create quite a bit of brand love. We have 2 projects with HBO, one on behavioral health. That'll air probably September of next year. And it's just a different mechanism that we use to invite consumers in, see the really special things that happen in our institutions and the special people who provide care. It provides context and dimension to what otherwise I can't do in the 30-second ad. And the key to doing it is to do it affordably and to do it in a way that is really thoughtful on the content creation piece. You don't want crap going out there in the marketplace that's representing your brand. So we're very thoughtful on the projects that we pick, and we have a pipeline of projects that we're picking from, super selective in how we do it. But that's just one example, and there are many more.
You're also engaging other topics, and I'm curious what differences you're finding, say, when you talk about, I believe when I spoke to you, you're also talking about social and racial inequity in health treatment as well as food deserts.
Yes.
How are you coming at those differently? Yeah. Are you finding substantial differences in the ways in which you have to approach those topics, and Are you coming up with very different strategies?
Yeah, I'll take the food piece first. So it's kind of crazy that that consumers don't have access to the nourishment they need to sustain themselves. And very early on, we found that we did not have brand permission to advise consumers on food, because who wants to eat hospital food? So Northwell, as we do really well, took a little bit of a judo move and took that negative energy, and we decided to redefine food in our health system. So we hired a Michelin-starred chef. He became the chef-in-chief for the health system. He, in turn, hired a team of 5 additional Michelin-starred chefs and reimagined food in our institutions. Literally ripped out fryers, put in fresh chilled freezers, went from farm to bedside, all freshly prepared. And two things happened. One, Our patient engagement scores skyrocketed on the food piece. We were at the 27th percentile. We've rocketed up to the 94th percentile in terms of that experience. And that has acted as a brand platform to now talk about the rest of the food issue. So now we've partnered with those same farms who are providing us with the food to cook to provide to patients so that there is a route to nourishment as they're recovering from their procedures. That got picked up by People magazine 2 weeks ago. There's a big spread that's coming out in the Wall Street Journal, the Washington Post, where a reporter embedded for 3 days in one of our hospitals to experience it. And we'll probably do a cookbook, although who wants cooking recipes from a hospital? I'm not sure, but we'll figure that out. But there's a ton of ways to activate that. And the key for us is, let's take cues from other industries that do this really well, that engage with consumers really well. That's what led to the whole entertainment marketing piece. We're a big student of digital capabilities and digital engagement. Retail does this wonderfully. And we have millions of square feet. How do we rethink our platform in a way that engages with consumers a bit differently? So you'll see us continue to do frontier work on this effort. By the way, I also have my list of failures, which I'm not going to share with you today. So.
Well, Ramon and Scott are both going to host a roundtable at the end of the morning on the topic of meaningful failures, so maybe you can ply some of the failures out of them there.
Course.
Oops, I'm sorry.
Hi, Isabel from Cargo. Nice to meet you.
Very nice to meet you.
I was wondering how you track all the return on investment on these campaigns. I know that you mentioned before it's not necessarily like you go and buy something at a hospital. So just wondering, like with those brand studies that you do, are you always running brand studies or how are you tracking that?
You know what this conversation reminds me of? The conversation that I recently had with my CFO about the exact same topic. So we work with a third-party organization that really tries to quantify the value of the brand. Media mix modeling, econometrics analysis, marginal dollar invested in the brand, return to the organization. Because we're in a place where it's harder to get the dollars, and I have to make decisions on, do I invest that clinically or do I invest that in other places? So there's this fight for capital. And we've had to arm ourselves in a much more sophisticated way than we've done in the past. Everything we've talked about is on the brand side of the equation. Probably 50–60% of what we do is on the performance side of the equation, where it's much more cause and effect. I put stimulus out. It's for a category targeting an individual who's predisposed to a certain health condition, and we can track and see them come through the systems. So that's easier to do. The brand stuff's a little bit harder to do, but we're wrapping our arms around it. All right, thanks.
Ramon, thank you so much.
Yes, thank you guys, pleasure.